When it comes to the coronavirus, COVID-19, this pandemic, as you know, the World Health Organization has failed the world, and Australia is putting itself at the forefront of efforts to fix the organisation. But the first thing that must happen is the Director General of the WHO has to go. Donald Trump has tackled the organisation head-on and frozen its funding until it gets its act together.
They've been wrong about a lot of things, and they had a lot of information early, and they didn't want to. They seem to be very China-centric.
Scott Morrison isn't cutting funds, but is pushing for greater powers for the WHO so that it can go in and investigate a virus outbreak in any place, in any country it likes. This is vitally important because while the Chinese communist regime suppressed information about the coronavirus outbreak in Wuhan and failed to protect its people, China also failed to stop the spread of the disease around the world, and the WHO did not call it out. Instead, its chief, Tedros Adhanom Ghebreyesus, visited Beijing late in January, was feted by Xi Jinping and obviously was hoodwinked too, because when he returned to WHO headquarters in Geneva, he had nothing but praise and reassurance about the way China was handling the epidemic.
Because of this strategy, and if it weren't for China's efforts, the number of cases outside China would have been very much higher.
Talk about getting ahead of yourself. And at this same briefing, Dr Ghebreyesus made light of the disease.
Don't worry, it's not corona.
And more importantly, with countries like Australia and the US already banning flights from Wuhan and the rest of China, he hit out at such travel bans, suggesting people should still be free to move around the world.
There is no reason for measures that unnecessarily interfere with international travel and trade.
That surely was his greatest mistake, and it was one, thankfully, that many countries, including our own, ignored. Incredibly, the following day, he suggested that bans and restrictions might be doing more harm than good.
Such restrictions can have the effect of increasing fear and stigma with little public health benefit.
Throughout February, as global cases spread, especially in Iran and Italy, the WHO refused to upgrade the spread of COVID-19 from emergency level to pandemic status. Australia declared it a pandemic on February the 27th, and it took the WHO almost another 2 weeks, 13 days to be precise, before it declared a pandemic on March the 11th. Over that period, the number of cases increased more than tenfold, and the number of countries affected tripled. Still, just yesterday, Dr Ghebreyesus defended his actions and his timing, boasting about the low number of cases when he first declared an emergency, although he messed up an important qualifier.
To be specific, 82 confirmed cases on January 30.
Outside of China. Outside of China.
Outside China. Of course, in China we had more cases.
Yep, that was an absolutely crucial time in late January when known infections outside China were low, but that's exactly when he was criticising countries for banning flights into and out of China. This was when the WHO was effectively encouraging travel into and out of regions hit by the outbreak. So this is when the virus was spreading with the encouragement of the WHO, which was also refusing to declare a pandemic. Little wonder then that Home Affairs Minister Peter Dutton agrees that any reform of the WHO and any increased powers must involve Dr Ghebreyesus moving on.
That if we are to trust the World Health Organization, it can't be under the current Ethiopian leader.
I agree with that. I think the credibility problem is very real, and I think it's tangible.
Surely this can't happen soon enough. We've already seen how delayed action can lead to disastrous consequences. If you support the WHO, or at least if you support its aims of improving health outcomes around the globe, surely this bloke's got to go, sooner rather than later. Maybe they'll have a job for him in Beijing.